Hello, and welcome to our Spirit of Women program. Tonight we're going to focus on the thyroid and what it could be trying to tell you. Also, our Genesis Behavioral Health Services will give us some tips on how to reduce and manage stress. And then later we'll be joined by Sandy Booth from the Yoga Booth, who will have a special yoga demonstration for us. Be sure to add your name to the comments during the live broadcast to enter for a chance to win a door prize from our Spirit of Women business partners. Now, to get our program started, I'd like to introduce to you Nick Ryan, Practice Administrator with Genesis Physician Services. Welcome, Nick.
Thanks, Linda. Your thyroid gland influences almost all of the metabolic processes in your body. When this is out of balance, it can cause a wide range of discomforting symptoms. Most thyroid problems can be managed if properly diagnosed and treated. Tonight, Dr. Ajaz, endocrinologist, and Allison Dale, nurse practitioner from Genesis Endocrinology, will help you understand how the thyroid works and what it could be telling you. Dr. Ajaz is a board-certified endocrinologist. He completed his fellowship in endocrinology, diabetes, and metabolism at University of Arkansas for Medical Sciences in Little Rock. He completed his internal medicine residency at St. Barnabas Hospital in Bronx, New York. He is a fellow American College of Endocrinology and a fellow of the Royal College of Physicians of United Kingdom. Dr. Ajaz has been with Genesis since 2009. Allison Dale is a board-certified nurse practitioner with special certifications in diabetes care and education. She completed her Master of Science in Nursing at Walden University and also completed her Doctor of Nursing practice from Walden University. Allison joined Genesis Endocrinology in 2017. Welcome, Dr. Ajaz and Allison.
Thank you, Nick, for the introduction. Hello, Dr. Ajaz. Let's start by telling our viewers what the thyroid gland is and what it does.
Hello, thank you, Allison, for letting me talk about thyroid. So thyroid is a small gland in the neck. It's located in front of the windpipe below voice box. It secretes thyroid hormone into the blood. Thyroid hormone controls various organs in the body. It helps them use the energy more effectively and keep heart, brain, muscles, and various organs working normally. So this is the thyroid gland. This is trachea or windpipe. Thyroid is located right in the front of the neck. It's a small butterfly-shaped gland.
That's a great explanation. What are the types of thyroid disorders that can affect a person?
There are two common thyroid disorders that affect a person. They include hyperthyroidism or overactive thyroid and hypothyroidism or underactive thyroid.
Thank you. What are the symptoms of hyperthyroidism?
Hyperthyroidism is due to excess production of thyroid hormone into the blood, and because of that, there are several symptoms which the patients feel. So there are various causes of hyperthyroidism. The most common cause of hyperthyroidism is Graves' disease. In Graves' disease, our body produces thyroid antibodies that stimulate thyroid gland, and in turn, thyroid gland produces too much thyroid hormone. Other causes of hyperthyroidism include single or multiple nodules producing too much thyroid hormones. Now let's talk about symptoms of hyperthyroidism. Symptoms of hyperthyroidism include anxiety, irritability, feeling tired, difficulty tolerating heat, trouble sleeping, tremors, rapid and irregular heartbeat, frequent bowel movements and sometimes diarrhea, weight loss, mood swings, and enlarged thyroid gland. Now, in Graves' disease, there may be bulging eyes, which is called exophthalmos. Now, how is hyperthyroidism diagnosed? So hyperthyroidism is diagnosed by symptoms, then physical examination, then blood work, and imaging studies. In the physical exam, a typical hyperthyroid patient is anxious looking with tremors, sweating, and with an enlarged thyroid gland. If patient has Graves' disease, he may have bulging eyes, which is called exophthalmos. After we see a patient with these clinical features, we do some blood testing to confirm hyperthyroidism. The blood testing for hyperthyroidism include TSH, free T4, free T3, and thyroid stimulating antibodies and thyroid receptor antibodies. TSH, which is produced by pituitary gland, is low. Free T4 and free T3, which are thyroid hormones, are high. And if patient has Graves' disease, then TSI or thyroid stimulating immunoglobulin and thyrotropin receptor antibodies are positive. So the imaging studies for hyperthyroidism include nuclear medicine, thyroid uptake, and scan. In hyperthyroidism, 24-hour uptake is elevated. In Graves' disease, there is diffuse uptake. In heart, single or multiple nodules, there is patchy uptake. Now, there is another condition which is called thyroiditis. In that condition, thyroid uptake is very low. So the thyroid gland does not produce more thyroid hormone, but secretes it into the blood rapidly. This is a temporary condition which resolves within 2 to 3 months. So thyroid scan is a very effective way of differentiating between thyroiditis and hyperthyroidism.
That's great information. How is hyperthyroidism treated?
So there are 3 treatment options for hyperthyroidism. The choice depends on the patient's preference, patient's other medical conditions, age, pregnancy status, and cause of the hyperthyroidism. One treatment option is antithyroid medications. The most commonly used medicine is methimazole. The second medicine is PTU, which is not commonly used due to increased side effects. Methimazole can make thyroid function normal. It's typically used for 12 to 18 months. In Graves' disease, after methimazole is stopped, there is about 30% chance of long-term remission. In other patients, there is recurrence of hyperthyroidism. Very rarely, antithyroid medications can cause side effects such as decrease in white blood cells and liver problems. The second treatment option is radioactive iodine ablation. If a patient chooses this treatment option, then he or she ingests a capsule containing I-131. Now, the thyroid gland would uptake any iodine in the body. Once patient ingests radioactive iodine, it goes to the thyroid gland and kills thyroid cells by radiation. Within the next 2 to 3 months, the patients become hypothyroid, and at that time, he or she needs to be started on thyroid hormone replacement. After radioactive iodine treatment, the patient needs to be away from other people, especially kids and pregnant ladies. The third treatment option is surgery. If that option is chosen, then the patient is referred to a surgeon who has experience in thyroid surgeries. After thyroid gland is removed, patient is started on thyroid hormones. Rare complications of thyroid surgery include damage to the parathyroid glands, which can cause low calcium in the blood, and damage to the nerves that go to the vocal cords, and the patients can get hoarseness from that. Now, we frequently use beta blockers with all these 3 treatment options. Beta blockers help with the symptoms of hyperthyroidism, such as fast heart rate, tremors, and anxiety. It does not treat the cause of hyperthyroidism.
Thank you. Now let's discuss the underactive thyroid disorder, hypothyroidism.
Yeah, hypothyroidism is the other important thyroid condition that affects a person. Hypothyroidism means underactive thyroid. The thyroid gland does not produce enough thyroid hormone, and so patients get symptoms of hypothyroidism. Various causes of hypothyroidism include Hashimoto's thyroiditis, which is the most common cause of hypothyroidism. In this condition, we produce antibodies that attack thyroid gland and then decrease thyroid hormone secretion. Other causes of hypothyroidism include surgical removal for causes such as thyroid cancer, thyroid nodule, and sometimes hyperthyroidism. Another cause of hypothyroidism is I-131 treatment for Graves' disease or thyroid cancer, or radiation to the neck area for other cancers. There is also a congenital hypothyroidism, which is basically there are some babies who are born without a thyroid gland and they are started on thyroid hormone from the birth. So let me talk about symptoms of hypothyroidism. Common symptoms of hypothyroidism are feeling weak and tired, weight gain, trouble tolerating cold, joint and muscle pain, constipation, dry skin, hair loss, heavy or irregular menstrual periods, difficulty becoming pregnant, depression, memory problems, and slowed heart rate. So hypothyroidism is diagnosed by symptoms, a physical examination, and lab tests. In the physical exam, typically the patient is overweight or obese with a dry skin, with thinning of eyebrows, slow tendon reflexes, and depressed looking. The blood tests include TSH, free T4, and thyroid antibodies. TSH is typically high, free T4 is low, and thyroid peroxidase antibodies and thyroglobulin antibodies could be positive in Hashimoto's thyroiditis.
How is hyperthyroidism treated?
So hypothyroidism is treated by replacing thyroid hormone. Levothyroxine is a synthetic thyroid hormone that has been in use for more than 50 years. It effectively treats most of the hypothyroid patients. Very rarely patients don't feel good or their labs do not become normal, then we add another medicine, leothyronine or cytomel. That's a T3 medicine which we use on and off.
Are there any medications or conditions that will affect thyroid blood test results?
That's a very good and interesting question. A lot of times we see patients with abnormal thyroid labs when actually they don't have any thyroid disorder. So several medicines and conditions can affect thyroid blood tests. One of the commonly used medicines is biotin. Biotin is a vitamin that people use for hair loss. It can make thyroid labs abnormal. If you stop biotin for 2 to 3 days before the labs, then the labs become normal. So always ask patients to stop biotin for a few days before thyroid labs. Another medicine which can affect your thyroid labs are steroids. And then if patient is hospitalized for a non-thyroidal illness, their blood tests may become abnormal. None of these conditions require treatment.
As you know, we also see thyroid nodules and thyroid cancer. What are the symptoms of these disorders and how are they diagnosed?
That's a good question, Alison. Thyroid nodules are extremely common. Actually, almost half of the population have thyroid nodules. Now, these days, most of the thyroid nodules are diagnosed incidentally. When patients get imaging studies for an unrelated problem, it's seen that they have a thyroid nodule. The best imaging study for a thyroid nodule is ultrasound. If on the ultrasound they have certain characteristics and if the size is big, then we get fine needle aspiration biopsy. Now, more than 95% of these nodules are benign. In about 5%, they may have thyroid cancer. Thyroid cancer is more common in patients who have a family history of thyroid cancer, who have history of radiation to their neck area, or they are more than 40 years of age. Now, thyroid cancer is treated by surgery, sometimes followed by radioactive iodine. Thyroid cancer is very easily treated and is potentially curable cancer. Now, I'll show you a thyroid nodule on the model. So this is a thyroid nodule. When we see something like this, then we get a needle biopsy to make sure it's not cancerous. If the nodule is benign and if the patient does not have any symptoms like difficulty swallowing or breathing, then we just leave it alone. Most of the thyroid nodules are asymptomatic. Very rarely patients may have some compressive symptoms if the nodules is too big.
Thank you for the information. It is important to listen to what your body is telling you. How does stress impact the thyroid, Dr. Ajaz?
It's an interesting question. A lot of patients ask this question. Actually, stress does not cause any thyroid disorder, but if patients already have a thyroid disorder, then stress can have an effect on their symptoms. During stress, our body produces too much cortisol. Cortisol can impact thyroid hormone levels in the blood, and then their symptoms of overactive thyroid or underactive thyroid can increase.
Thank you, Dr. Ajaz. If you think you are having any symptoms of thyroid disorder, it is important to discuss these symptoms with your primary care provider to determine your next steps.
Thank you, Dr. Ajaz and Allison. If you need help in finding a family doctor in your area, call OneCall at 740-455-7500. Next, we welcome Denise Williams, Manager of Genesis Behavioral Health, to give us tips on managing stress. Welcome, Denise.
Thanks, Nick. I am happy to be here this evening. I'm going to talk to you a little bit about how we can reduce stress to maintain a healthy thyroid. Stress triggers the release of the hormone cortisol, and cortisol triggers the fight or flight response. which gears our body up for action. We know that higher or more prolonged levels of cortisol in the bloodstream, are like those associated with chronic stress, have been shown to have negative effects on the body, such as suppressing the thyroid function. So let's look at what stress is. And I love this definition. Stress is the body's response to the mind's perception that the environment is too demanding. We think or believe we are being threatened, and our body responds. Stress activates the sympathetic nervous system, which releases the hormone cortisol. Okay, so let's talk about some indicators of physical stress. Muscle tension is very common. It can be muscle tension in our neck or back and legs. Headaches, tension headaches or migraine headaches. Digestive problems. Sometimes we eat too much or overeat, and then our digestive system doesn't work well, which can result also in constipation and diarrhea. Sleep problems are real common. Maybe sleeping too much or not enough, or waking up in the middle of the night. Teeth grinding, and also other kinds of jaw aching and pain can be indicators of stress. Heart problems such as palpitations, heartbeat, chest pain, breathing, just difficulty catching our breath, and having, which can also cause chest pain. High blood pressure can be an indication of stress, and so can skin eruptions like rashes, hives, eczema, and itching. So let's talk about some emotional stress indicators. Depression can occur where a person has fatigue, loss of energy, confusion, difficulty making decisions, irritability, or just emotions that are untethered and out of control, pacing, impatience, restlessness, also nervous mannerisms like tics and finger tapping, tiredness, boredom, low energy and fatigue, and difficulty making decisions, which goes along with the lack of concentration and poor memory, and also just a feeling of being overwhelmed and out of control. So now we can talk about some ways to handle stress in healthy ways. Some immediate or short-term methods for reducing stress are getting a hug from someone. We know that getting a hug from someone it releases endorphins, which make us feel good. Also, it's just nice to have someone around you that cares for you. Enjoying aromatherapy, and I think of activities that affect us, affect our senses. So things that smell good can be air fresheners or candles. Also, music is a real popular stress reducer, something that we can hear. And I also think of things that we can feel. So like putting lotions on, or getting a massage, or wearing your soft bunny slippers, anything that just feels good on your body. Also taking a time out. Maybe you're at work or you just need to get away, so it might be that you take a walk outside, or maybe even if you can't get away, but just going to the bathroom and closing the door and taking some deep breaths and taking some time to yourself. Chewing gum can be a way of reducing stress on a short-term basis because it does relieve stress and anxiety. Laughter is always the best medicine if you're stressed. So being around people that laugh, watching sitcoms that make you laugh, just having that good belly laugh releases endorphins that, again, give us that good feeling. Pets are excellent ways of reducing stress. It's always nice to be greeted by your pet when you come home. And also we know that just the action of petting an animal reduces blood pressure and breathing and calms us down. And also pets can be very entertaining, and they can make us laugh as well. Deep breathing exercises, meditation, and relaxation, those are all excellent activities, and we'll talk about those a little bit more. And another good option is just to talk to someone. The opportunity to release your stress, talk about the problems, gets it out of you, and it also may help you to solve the problems that are going on as well. Now let's talk about some lifestyle changes that we can do to reduce stress. The first one is being aware of your thoughts and our self-talk. We talk to ourselves more than we talk to anybody else, and sometimes what we say to ourselves is very negative or very critical or insulting, and we want to be aware of what we're saying and reduce or eliminate that self-talk that is negative, because that does increase our stress level. It is important to eat and drink to optimize health. Now sometimes we think of or we use alcohol or food to reduce stress. And it does reduce stress in the short run, but in the long run it may actually cause more health problems and increase our stress. It is important to look at your caffeine use, and again we think of caffeine as a way of reducing stress, but caffeine is actually a stimulant which revs up the body and can also interfere with sleep. Exercise is one of the most important things that we can do to combat stress. Exercise reduces the stress hormones, including cortisol. It also helps release endorphins that make us feel good. It increases sleep. Or it improves sleep because exercise relaxes us, wears us out, makes us tired, and then we're much more likely to sleep well. Exercise also increases our confidence. If we're exercising regularly, we're going to feel more competent and confident, which in turn promotes healthy well-being. It is important to find an exercise routine that you enjoy, that doesn't feel like a chore. So walking, dancing, rock climbing, yoga, particularly activities that involve repetitive movements of large muscle groups are particularly stress relieving. You want to look at your use of tobacco and nicotine products. And again, we look at nicotine as a stress reliever. However, nicotine actually places more stress on the body by increasing physical arousal and reducing blood flow and breathing. Practicing relaxation techniques is very beneficial to managing stress because these activities protect the body from stress and they give us a chance to take a break and take care of ourselves. And there are a lot of different stress management exercises that you can learn on YouTube and iPhone apps and online. These activities such as deep breathing, imagery, progressive muscle relaxation, and mindfulness meditation are very easy to use. You can do it by yourself, and they have very quick benefit. The last one is to reduce your stress triggers. We all know there are people, places, and demands on us that cause us stress. And it is important to prioritize how we spend our time and free up time to take care of ourselves. So freeing up time and making ourselves a priority and using that time to do activities that take care of ourselves, reduce our stress, and eliminate those things in our life that maybe we don't need. If you have recognized stress in your life, I hope you can identify one or two of these behaviors that you can adopt to manage your stress and keep your thyroid healthy. I encourage starting with one change for a period of maybe 4 to 6 weeks and then adding another positive change. Not making a lot of changes at once will increase your success of changing your lifestyle. As I mentioned before, yoga is another great way to reduce stress. Sandy Booth, owner of the Yoga Booth, will now show us some yoga techniques to reduce stress.
Thank you, Denise. I'm Sandy Booth with the Yoga Booth, and I want to show you a few ways that you can reduce stress in your life. You don't have to go to a yoga class. You don't have to have a lot of equipment. You don't have to have anything special. A lot of what I'd like to show you, you can do right in your own home, in your living room, your bedroom, or wherever is convenient. You can do it in the car. Yoga is universal. It's holistic. It is mind, body, spirit. And it is a great tool to have as we deal with stress or depression or anxiety. It may not cure you, but it will give you tools to make you feel better. So one of the things that I love to offer is just simple breathing techniques. And as we go into a yoga class, we tune into our breath. We notice how the inhale comes in and the exhale goes out. And one of the techniques I like to use is an inhale and an exhale box breathing. So as you inhale, you count to 4, you hold the breath for 2, and you exhale to 4. So I'll demonstrate real quickly. On the inhale, 1, 2, 3, 4, hold, 1, 2, Exhale. 1, 2, 3, 4. Hold. 1, 2. And that's just a simple little thing. If you have problems going to sleep and you're laying in your bed and the mind is racing, if you focus on breath and count the inhales and the exhales, it will relax the body. Breath can be a tool to access the central nervous system. It can lower blood pressure. It can lower heart rate. And it can give you a general feeling of calm if you tune into your breath. So I encourage you to try that. Another thing is easy stretches and getting your mind into your body. Learning to just feel your body as it stretches deep in any kind of a movement. So a couple real easy stretches from a seated position along with breath would be to inhale the arms up. Exhale the hands to heart center. And then taking the hand off to the side, and you can be in a chair or on the floor, and just reaching over top of the head, taking a deep breath in. And on the exhale, reaching to the opposite side, take a nice deep stretch and a deep breath in. And one more time. Flowing with the inhale and the exhale. And then coming back to center. And you can go through that several times. There are several ways to use your body and your breath together that can help you find a more relaxed state. Another thing that you can do to help yourself relax, and this is really good as you're again, in the evenings, if you've had a really long day and you're thinking about settling in to go to sleep, and sleep can be very evasive for a lot of us as we deal with stress. Coming to a relaxed reclined pose where the body is supported in a way that it can finally relax and release. So let me show you one really quick technique. And you can do this with a rolled up blanket, a pillow. I have a yoga bolster here. If you come to a yoga class, we use these a lot. So a firm pillow under the legs or the knees, a small blanket or pillow under the head, and then coming down into a relaxed, reclined position. Making sure the blanket or the pillow is close to up to the top of the back of the legs. And then feeling the body settle in onto whatever surface you're on. Opening the hands, let the feet relax. Notice how the body drops in, how the spine starts to relax. Tuning in and realizing how the breath feels. Maybe slowing the breath down. Closing the eyes. Just being in a space of calm. A final thing about a yoga class or relaxation and body awareness, mental awareness in yoga. When we finish a yoga class, after we have done our final relaxation, we come to a seat, we take a deep breath in, and we wish each other well. And we do it in a very special way. And it's called namaste. And I'd like to explain that to you because sometimes there's some misconceptions about what namaste means. So if you ever hear the greeting of Namaste, it's a greeting of goodwill. And it means all that is good and light in me recognizes and honors all that is good and light in you. So I invite you to try yoga. I invite you to find calm and inner peace using some of these techniques.
I hope you enjoyed our program this evening, and thanks to all our presenters for the great information they shared with us tonight. If you have not already added your name to the comments below, please do so now for your chance to win a door prize. We'll accept your name for 5 more minutes after the live program ends, and then we'll notify our winners via Facebook Messenger. Thank you for joining us this evening, and if you're not a Spirit of Women member, I invite you to join tonight by clicking the link in the comments below. As a member, you'll stay up to date on new programs and have a resource to health education, and you won't want to miss our fall season. Thank you and have a good evening.